Okay, let's dive into this. Making those big healthcare decisions, it can feel incredibly overwhelming, can it?
Definitely.
Especially when you start looking beyond, your local options, maybe even thinking about going overseas.
Yeah, it's suddenly like this flood of information, different health systems, weird costs, providers you've never heard of.
Exactly. How do you even begin to sort through all that on your own? It's a lot.
And you're often dealing with it while feeling vulnerable, right? Because
Yeah.
you actually need medical care. The stakes just feel incredibly high.
Absolutely. And that's precisely the challenge this deep dive is set up to help you navigate. We've taken that stack of sources you provided, all the articles, the research, the notes, to try and cut through some of that noise.
hmm
We really want to unpack the crucial role of these medical tourism facilitators and concierges.
And these sources, they give us a direct line to insights from people actually doing this work. We've got
Yeah.
Shirley Whitfield in the U.S., Giselle Massam in the U.K., experts on the ground. So our mission here is really to pull out the most important bits of knowledge from what they shared. Sometimes surprising things, actually.
Yeah.
We want to help you understand who these people are, why they might be honestly invaluable if you're thinking about care abroad, and what you really need to grasp before you even, book a flight.
Think of this as a shortcut, maybe. Getting you well informed on a really complex topic, finding those insights you might miss just scrolling online.
Okay, so who are they, these experts? Your sources introduce Shirley and Jazelle, U.S. and U.K. based.
Mm-hmm.
And they touch on the terms medical tourism facilitator and medical concierge. They admit the terms sometimes get used interchangeably.
Which adds to the confusion, right? You might think a facilitator travels with you, maybe, and a concierge handles things when you arrive somewhere specific.
Sort of. Based on their chat, it seems like a concierge often has a deep focus, maybe inbound care for a particular country, or even a specific medical field. They handle everything end-to-end within that niche.
Yeah.
Whereas a facilitator might have a wider, more global network. They help patients find care in various countries, depending on what's needed.
But really, the label isn't the main thing. What matters is that both roles involve a ton of behind-the-scenes work.
Exactly. Their core goal is the same. Take the stress and the unknowns out of traveling for healthcare for you.
And it's fascinating how they got into this. The sources point out something I found really interesting. You don't necessarily need a clinical background.
Right. It's not a must-have.
Which surprised me. I mean, look at Giselle. She does have that deep clinical history. Cardiac nurse, long hours in the ER, high-level hospital management.
Yeah, she even ran hospitals. That clinical knowledge is obviously a huge plus for her.
But her inspiration, what really pushed her into the concierge side for international patients, was intensely personal.
It was about her father, wasn't it?
Yeah.
Living abroad, needing major spinal surgery.
Yeah, and she felt that anxiety we talked about, trying to find the absolute best options, specifically focusing on minimally invasive techniques with, proven results.
She talks about waiting during his surgery in the UK, picturing him frail, maybe in intensive care
It
afterwards.
gave you chills. And then she saw him just 20 minutes post-op, sitting up, eating dinner, totally alert
Amazing.
after spinal surgery. Just a tiny plaster on his neck because the surgeon used those advanced, minimally invasive methods.
And seeing that, his incredibly fast recovery, because he wasn't opened up traditionally, that sparked the idea for her company, MetaHealth.
Mm-hmm.
She wanted other families, other people to have access to that kind of outcome.
That's a really powerful why. Now, Shirley's path, totally different, but just as relevant somehow.
So diverse. Pharmaceutical exec launching drugs globally, then Wall Street finance, wealth management, even owning spas.
Right. Her motivation came from seeing something concerning. People, and she specifically mentioned Black women, having really bad complications after going abroad for elective surgeries without the right support or, frankly, proper vetting.
She realized she had this unique toolkit, global business smarts, finance background, and she's traveled extensively over 40 countries.
Right.
Skills she could use to help keep people safe, advocate for them in this complex space.
So the big takeaway from their different stories, and the sources really underline this, is that clinical knowledge helps, sure, but the non-negotiables. Being incredibly detail-oriented, flexible, knowing your stuff about global systems, or being able to learn fast, and having that entrepreneurial spirit to solve really complex problems for people.
Which brings us right to the crucial question for anyone listening who's thinking about this. Why pay for a professional service?
Yeah, especially if you're going abroad partly to save money, wouldn't doing it yourself be even cheaper?
It's a fair question. And maybe the most surprising thing here is that paying someone could actually save you money and prevent a whole lot of potential pain in the long run.
How so? Because trying to DIY international healthcare, it might look cheaper up front, but like the experts say, it's not just booking a flight and a hotel room.
Not at all. You're stepping into a really complex, potentially risky environment. I mean, any healthcare journey has risks, right? But going abroad adds layers you might not even anticipate. A professional's key value is helping you manage that extra risk.
Okay, how do they do that specifically? Vetting seems huge.
Absolutely. People like Shirley and Jazelle, they don't just, pick a clinic from a brochure. They use their networks, strict criteria, their experience to find reputable places.
And that's critical because, let's be blunt, the quality of care can vary wildly.
Hugely. They talked about checking for big international accreditations like JCI or ISO, but also country-specific ones. Jazelle mentioned the UK's CQC Ratings Care Quality Commission.
Right.
They only work with facilities rated good or outstanding. These ratings aren't just fluff. They come from tough inspections on safety, effectiveness, how patients are treated.
Things you probably wouldn't know how to check thoroughly yourself from thousands of miles away.
Exactly. And then there's just the sheer logistical headache you avoid.
Oh, I can only imagine.
They handle all the practical stuff that would be super stressful to coordinate remotely. Arranging consultations, finding accommodation that actually fits your needs, like maybe needing a ground floor room post-surgery.
Yeah, good point.
Arranging transport, airport pickups, coordinating all the appointments, medical, diagnostic tests, the really crucial aftercare. It's like having a dedicated project manager just for your health journey.
And crucially, they're with you on the journey, metaphorically or sometimes literally.
Right. Think about being in a foreign country, maybe recovering, feeling vulnerable. Having someone who gets the system, can speak up for you, knows a plan B if something unexpected happens, that's invaluable.
They're your advocate, making sure you understand the procedures, the consent forms, and critically, what happens if there are complications or you need follow-up.
And they highlighted how often things go wrong because people lacked that support.
Like what?
Like doctors back home being unwilling or maybe unable to fix issues from surgery done elsewhere, or patients just not grasping the real risks beforehand, or having completely unrealistic expectations based on, glossy social media posts.
Okay, so what does the process actually look like if you decide to work with someone like this?
Well, based on the sources, it usually kicks off with an initial chat, a consultation.
And this is key, right? It's not just find me a surgeon. It's a deeper conversation to understand you.
Exactly. Your health problems, sure, but also your lifestyle, past treatments, and really importantly, what outcome are you truly looking for? Not just the operation, but the impact you want it to have on your life.
Makes sense.
Based on that deep understanding, they go into their vetted networks to find providers who are a good match for you. They made the point that the perfect surgeon for patient A might not be right for patient B. It's very personalized. And they also stress that you need to do your own homework too and feel really comfortable with who they recommend.
And you'd need to provide your medical history, right? Scans, doctor's notes.
Yep, all that existing info so the potential providers have the background.
Then you talk to the provider, maybe virtually first.
Often, yeah. A virtual consultation usually comes next. And that leads to getting an estimated cost package.
And they seem pretty clear about transparency here. The package should break down the treatment costs, the facilitator or concierge fee, maybe accommodation, transport.
Yes, all laid out. But they also recommend having a financial cushion. Because even with the best planning, healthcare can throw curveballs.
Good advice.
And aftercare, follow-up. This came up again and again as absolutely vital.
What does that involve?
Could be anything from arranging private nursing, maybe a stay in a rehab facility, wound checks, follow-up appointments before you fly home.
Okay.
And, critically, support for sorting out follow-up after you're back in your home country, too.
And what about managing expectations, especially with, say, elective cosmetic stuff?
That's a big part of their job, too. They talked about how reputable providers will refuse procedures if they think the patient's goals are unrealistic or maybe unsafe.
Right.
A good facilitator helps navigate that, maybe suggesting safer alternatives or sometimes even gently guiding someone towards non-surgical options, or even mental health support if it seems like there are deeper issues driving requests for repeated surgeries.
Okay, let's get into the numbers. Because safety and logistics are paramount. But let's face it, the potential cost savings are a huge driver for a lot of people.
Absolutely. And the sources gave some pretty compelling examples.
He really did. That hip replacement comparison was striking.
Yeah, a minimally invasive package in the UK, they said around 36,000 to 38,000 US. And get this, that price included the surgery plus 4 weeks of accommodation and aftercare.
4 weeks? Compared to what?
Compared to the US cost, which they pegged at $60,000 to $80,000, maybe even more, just for the surgery itself.
Wow.
The difference is massive. And you're potentially getting that minimally invasive approach, which often means faster recovery, less pain, no drain needed usually. Better outcomes potentially for way less money.
And the cardiac surgery example, even more dramatic.
Right. Standard open heart in the U.S., easily $200,000 plus.
Okay.
The minimally invasive options they work with over in the U.K., around $70,000 US for minimal incision, or maybe $90,000 to $100,000 for going between the ribs without cracking the breastbone.
Again, a fraction of the U.S. cost.
A huge fraction. Plus, the recovery benefits less trauma, quicker healing, lower infection risk compared to traditional open procedures. It's significant.
So what about the cost of the facilitator or concierge themselves? How does that work?
It varies. Shirley mentioned her model, free initial chat, then a $200 planning fee, and then she often works on commission from travel partners, so sometimes no extra fee to the patient after that initial planning part.
Okay.
Giselle has tiered packages. Her silver package, covering accommodation and logistics for simpler things, starts around $3,995, which is roughly $3,995 US.
But the key is those initial conversations to just explore options are usually free.
Right. No commitment, just to talk.
And Shirley also mentioned something unique, didn't she? A training program.
Yeah, to teach people how to safely plan their own medical trip, or maybe even help friends or family do it. Empowering people with the knowledge.
I liked that. And her slightly out there idea about recovery.
Oh, the cruise. Yeah, recovering on a cruise ship after surgery in the Caribbean. It sounded kind of brilliant care, logistics, maybe even a bit of recuperative sunshine, all managed.
Creative thinking.
Definitely.
No.
Now, your sources specifically brought up navigating certain destinations. Tiki came up, right? The rise in medical tourism there, sometimes called ethnic medical tourism, for specific procedures.
Yeah, you hear about it a lot. It's clearly popular, especially for things like hair transplants. They mention catering specifically to textured hair and dental work.
And the costs can be incredibly low. That example of a full diagnostic scan for less than the price of one MRI in the U.S., that catches your attention.
For sure.
But this is where that price isn't everything. Mantra becomes absolutely critical. Honestly, it's a bit of a cautionary tale in the sources.
Okay.
The experts, especially Jazelle, and they referenced UK government warnings. They highlighted some really significant risks.
Like what kind of risks?
Serious investigations into patient deaths, particularly linked to weight loss surgeries, gastric sleeves, bypasses. Reports of many UK citizens coming back with severe complications needing urgent, expensive care back home, often paid for by the taxpayer.
That's concerning.
Yeah, and concerns about how consistently things are regulated, major language barriers causing issues like people signing consent forms they don't fully understand.
Oh, wow.
Even reports from investigators posing as tourists who found some worrying practices.
So the Turkey example really hammers home the point, doesn't it?
Absolutely. It's a stark reminder. Low cost is tempting, incredibly tempting. But the potential risks in some places mean you have to be extremely careful. It powerfully reinforces why professional vetting, understanding the local rules, and having an advocate is so vital for your safety. It doesn't matter how popular a place is or how low the price tag looks.
Okay. So, pulling all these different threads together from this deep dive into your sources, what are the absolute core takeaways for you, the listener, considering your healthcare options?
First one, maybe the simplest. Your health is incredibly valuable. Prioritize it. Deal with issues, don't put them off.
Good starting point. Second, information is power, but you've got to be diligent. Do your homework beyond just social media hype or what a friend of a friend said. Really dig in.
Third, know that options do exist around the world. You might find high-quality care that's more affordable, or gets you seen faster, or offers less invasive techniques than what's easily available where you live.
Fourth, always understand the full picture before you commit to anything. Ask those detailed questions. What are the risks of this specific procedure? How are complications handled? What recovery support will I need? What's the plan for follow-up, both there and back home?
Get specific. And fifth, professional support concierges, they can be your essential partners in this. They help manage risk, vet providers properly, handle all those complicated logistics, and they advocate for you. That can save you massive stress, maybe prevent serious complications, and potentially even save you money overall.
And finally, never ever travel abroad for care or, frankly, any reason without comprehensive travel insurance. It's just a critical safety net.
Definitely. This deep dive, it's really opened up this complex world of medical tourism, hasn't it? Seeing it through the eyes of experts who live and breathe this stuff, helping people navigate it safely.
It really has. It shows that, yes, there are compelling potential upsides, cost, access, specific treatments, but they absolutely come with significant risks. Risks that need careful, informed management.
It's just so clear that having that knowledgeable guide, someone who really understands the terrain, can properly check out providers and stands with you as your advocate. It can make a world of difference to your safety and your outcome.
So the final thought to leave you with, something to mull over.
Yeah, it really makes you stop and think, doesn't it?
Yeah.
When you're making these crucial decisions about your own health, your well-being, how do you truly measure value? Is it just about that initial price tag you see advertised? Or is the real value measured by the assurance of safety, the confidence in quality, and maybe the peace of mind that comes from having an expert partner guiding you every single step of the way?